Dr. Conley, how is chemotherapy used to treat breast cancer?
So chemotherapy is commonly incorporated into a treatment plan for patients, although we are reassured that over time we are finding that less and less women actually need chemotherapy as we learn more about breast cancer and who may benefit from that treatment. But if we decide that a patient might benefit from chemotherapy, it is usually given either before surgery to shrink down the cancer and make the surgery easier and less intensive, or it can be given after surgery. And the idea is that we are trying to eliminate any abnormal cells that may not be reached by the actual surgery to minimize the chance of those cells causing a problem in the future for patients. And chemotherapy is given through an IV or can be given through what we call a port, which is an indwelling IV, which makes life sometimes easier for patients. In the past, patients could get quite sick with chemotherapy, and many people are afraid of that because of what they've heard or what they've seen with other friends or family members in the past. But nowadays, the medicines that we have to prevent nausea and other side effects are very effective. So the majority of the patients that we treat with chemotherapy for breast cancer do extremely well, have a lot less side effects than in the past, and can oftentimes continue their day-to-day, including working full-time. Each patient is slightly different in how they deal with chemotherapy, so we just tell patients we won't know for sure until we start, but we will support them as we can throughout the process. Chemotherapy oftentimes can result in hair loss, which can sometimes be minimized by the use of cold caps, for example. These are available at some centers. Chemotherapy can increase the chance of infection, but luckily serious infection is pretty rare in patients with breast cancer. It can also cause some tiredness, and a patient has to see how much tiredness they have to see what activities they can maintain. And another side effect that can be experienced is, for example, a numbness and tingling in the fingers or toes, which should be reported as it happens to the treating team. But in general, our patients who are recommended chemotherapy manage to get through and out the other side with the support that we have.